sick and tired of the high costs and inefficiency plaguing our U.S. healthcare system? Do you feel like you're navigating a maze when dealing with insurance companies, only to end up paying a fortune for basic medical services? Then this Broken Healthcare podcast is for you. So get ready to take control of your healthcare. Here's your host, Ray Kober.
And we're live. Ladies and gentlemen, it is an honor and a privilege to have with us in the studio today. We're not exactly in the studio. He's in his studio and I'm in my studio. The great, the incomparable Al Lewis, founder of Quizify, Harvard attorney extraordinaire, and the founder of something called Prevent Consent, which, by the way, is our free gift to anyone that visits our website. And without further ado, welcome to the big show, Al.
Well, thank you for having me on, Ray.
Thank you so much. So I want to get into it and take us back to how you got involved in healthcare to begin with. And I know that you're a Harvard trained attorney, and I don't think your career started out on the medical side of a practicing lawyer, but correct me if I'm wrong. Where did your trajectory, your career intersect with the medical field?
Well, what happened was when I was at law school, and all the law firms came to interview, and then there was an organization very small at the time called Bain and Company that was interviewing as well. And so I thought, out of curiosity, I'd go, and I was mesmerized by the charisma of the presenter, a mid-level employee there by the name of Mitt Romney. And,
that's a familiar name.
Yeah, I know it is. Back then, not so much, right? So I signed up with Bain. They put me on a healthcare case. And ever since, and it happened that I'd taken a bunch of the healthcare courses in law school just because it was interesting. Not having anything to do with Bain, really, but just legal background. It becomes very important when we get to this prevent consent. And so I did a whole bunch of healthcare consulting at Bain.
And then, Al, what does that look like to the layperson that's not familiar? What does a Bain do? What do you do at a Bain? Who would, without naming names, unless you care to, what type of organization would be hiring a Bain for your services, and what would you bring to the table?
Well, an organization where, to be honest, the CEO has so many layers below them that they don't really get what's going on down in the trenches. And we interview a bunch of people, and we typically found a bunch of things that should be done differently. Now, the business is different today. Today, they do a lot more sort of fast 30 to 60 day turnarounds for private equity, due diligence, that kind of thing. But back in my day, there, you drew your own slides. There's no PowerPoint or anything. You took when you went on a plane ride, you took your acetates and a little Sharpie, not a Sharpie, one of those little scalpel type things, and you made your own slides. Much different. But the bottom line is that we worked for a bunch of hospitals, worked for Baxter. I don't even know if Baxter's still around. And that's how I picked up, knowledge of healthcare. You got to know the jargon.
Sure.
And then, as a result of that knowledge, and through a whole bunch of lucky coincidences, I stumbled into running a legit healthcare company, a NASDAQ-listed healthcare company. Now, as NASDAQ-listed healthcare companies go, it was a fairly pathetic one, to be honest. Like every time I would come into work and there was a letter from NASDAQ on my desk, I was assuming they were telling us we were being delisted. We were NASDAQ nonetheless. And then we did a merger with another company. It was kind of a merger of equals, but they gave us a great deal because their CEO wanted to be CEO of the whole thing. And he gave us such a great deal that even though it was a merger of equals, I took it, right? And then I got into disease management very early on. Once again, just kind of stumbled into it. It didn't really, it was Humana that we were consulting for. This was at another consulting firm, not Bain, called Computer Sciences Corp. It was a division called Index. And they were paying us a lot of money. We didn't know what the hell we were doing. We were supposed to be re-engineering stuff in quotes, which was the fad of the day. but none of the people that I was working with or me knew anything about reengineering, right? So I somehow got the idea, and I can't remember why, that we should look disease by disease and see if they, as a health plan, could do anything about them and sort of reduce the cost and improve the quality. And I was just kind of explaining this to people. And I happen to know a couple of people who are running little vendors doing this. And I said, yeah, I think that's what we'd like to do. And somebody said, you mean like disease management? I said, yeah, that's it, disease management. And that was the first time I heard the term. Well, I knew I was on something. 3 years later, I started the Disease Management Association of America, and I pretty much owned the market. And there were just a couple. It's easier to name the health plans that were not members of my group than the ones who were, because there were only like 2 that weren't. And so I rode that horse as long as I possibly could. Then I ran some numbers. This was in 2000.
Well, back up a moment. So you didn't know what disease management was at the time, and I'm guessing my audience might not know what it is now.
Well, frankly, they're better off not knowing, if you want to know. But the idea was there were all these vendors. I mean, a few of them are still around, like ShareCare, for example. And if you look at their stock price, you can see why, there's no more disease management. The idea was like you would call people at home and you would say, well, let me help you with your disease, right? Well, as it turned out, number one, most people didn't want to get calls from their insurance companies to help them with their disease. That's what they had doctors for, right? And number two, they really weren't much help. And number three, at one point, one of the companies, ShareCare's predecessor called Healthways, got this great big deal with Blue Cross in Minnesota that had all this cigarette money that they needed to spend. And they thought they'd spend on disease management. And the Healthways was very well run for many years. And so they were really good at getting big accounts. The thing is, this account was just a little bit too big. And they made so many phone calls to people that at one point the Attorney General of the state of Minnesota had told them to stop calling people, So, and that was kind of the high point, the beginning of the end, and it just didn't work. That was the problem. I mean, Healthways did as well as they possibly could with this, but it just didn't work. I don't know how to tell you. So then I got into wellness because what happened was I had this great stream of income where I would put the vendors together with the customers, and I would disclose right in the RFP and in the contract that my fee was 0.25% of corpus. And they see the 1/4% but nobody ever asked me what corpus meant, and that was or claims corpus. That was the entire amount of claims that were related to the disease, so you could do very well on 1/4% of that. And
Sure.
So I had a great annuity going, but, and by the way, I did not do anything. Not only did I not do anything that anyone who was recording me at any point could ever use against me in a trial or anything, but just the opposite. I was the guy who first figured out that this stuff didn't save any money. And I said it in a conference, and there was a blogger in the conference who wrote it up. You can still find it. That headline was, the subject header was, "A founding father of disease management suddenly declares my kid is ugly." Okay. I still did the deals after that, but I would tell people, this doesn't really save any money. They said, no, we're supposed to be doing disease management, so we'll go ahead and do it. Fine, I disclose. It's like somebody buys a pack of cigarettes. They know they're going to get cancer,
what's unbelievable to me about that, Al? I spend my days speaking with CFOs and CEOs, and I show them in black and white that we will save the money. In fact, if we don't save the money, we put our fee at risk. And we are turned down left and right because they don't believe it. It's impossible, or they just don't feel comfortable because they just met us, which is a legit reason not to do business with us. I get that. But the idea that we have corporations out there that have money to burn and throw away on this nonsense, which by your own admission doesn't work. I mean, come on.
Well, give me a break. Right. It's not just that disease management didn't work. Disease management cost, I don't know, $1.50 a member, an employee a month, something like that.
Right.
It's that wellness was a humongous scam.
Right.
And so after this disease management train started slowing down, I thought, well, I ought to get into wellness because everybody says wellness saves money and it's much more lucrative because the budgets are much bigger for some reason. But the more I looked at it was a complete scam. And they didn't know they were scamming people. They were simply measuring incorrectly. Remember, I'm the guy who wrote the book, Why Nobody Believes the Numbers on Correct Measurement. So I knew after a while they were measuring things incorrectly. And so I told them.
And from what I recall, you're pretty good at math.
Just a little. Yeah. Like I'll bet anybody $1 million that my math is better than theirs. Right. So I don't brag. I bet. I don't argue. I bet.
Excellent.
And, Aon, I mean, the Wellness Industry Trade Association, all these people making these claims, I say, okay, let's bet. And sometimes, like for wellness, I even say, I'll give you 10 to 1 odds, 300,000, 3 million. No, they don't take it. They know they're lying at this point.
Right.
So in any event, I started, after I got into wellness, I started realizing that the way to do wellness was to get people out of it. And so I would get people out of it. And, they'd pay me a consulting fee, not an annuity like in disease management, but a fee, not a particularly high one. And then they'd say, okay, well, what should we do instead? And I never had an instead. Okay. But then what happened was, for reasons that really aren't, I mean, if this were like an hour podcast, I tell you the whole reason, but I ended up running or hosting a radio show on the NPR affiliate in Washington, D.C. Okay. It's in website. It's on my blog. The whole story is very funny.
You can take as much time as you need, by the way, Al. So don't rush on our account.
All right. Well, so what happened was this backstory. So this was before I got very happily remarried. I was dating this economist, this economist at Harvard, economics professor. And I'll even say her name. And I wish she would sue me because I would countersue for everything she's got. Her name was Beatrice Armendariz. And, she was lovely and charming and all this stuff. Well, it turned out she was a complete sociopath. Now, she had written an economics book, and I wanted to show I could write a better economics book than she could, even though I taught economics at Harvard for like 2 years in the early 80s. So I wrote this economics book. It was called Why the Heck Aren't We Already Doing This Stuff? And it was policy ideas that both the Democrats and the Republicans could agree on because none of them had thought of it. Okay. Well, the book maybe sold 500 copies, but one of the copies ended up in the hands of the program director at this radio station, WAMU, the American University radio station, NPR, but top radio station in DC, I might add. And so he says, there could really be a great show here. I mean, we'd have like a prominent Democrat and a prominent Republican on, and listeners would call in with their policy ideas. And if they could get both of them to agree, they'd agree to propose it in Congress. This was in the happier days when both parties worked together somewhat, right? Well, so they put on the show. It's called The Big Fix. You can still find the old episodes on the WAMU website. And so I had to host. They said, look, we don't have any money. We may be able to get sponsored. We don't have any money. So you have to come down and host, and we'll pay your travel, but we can't pay you. I said, fine. Who wouldn't take that opportunity, right? So I kind of stumbled through the hosting. I've been the guest on a lot of stuff, just like this. It's 10,000 times easier to be a guest than a host. Because, you got all these little buttons and buzzers and lights telling you how much time there is and whatnot.
Agreed.
And of course, who am I talking to here, right? The difference is actually, I was going to say you're taping yours, but ours was taped as well now I think about it. So, I got through it. And after the first episode, the host or the producer says, okay, it's coming along. You're coming along. You'll sound better when you're over your cold. Well, newsflash, Ray, what you hear is what you get, right? This is what I sound like, okay? So, so I kind of panicked, so I called back up to my PCP in Boston, and I say, somebody told me years ago I had a deviated septum, and I've got this radio show, and I got to get this thing fixed, or they're going to fire me, So this was also in the old days, you can get a specialist appointment really quickly. So she gets me into the ENT literally as soon as I come back from Boston, So the ENT puts a scope in my nose and stuff and says, oh, well, your deviated septum is the least of your problems. You got polyps, right? Okay, I've never heard of polyps. So she says, well, we should probably take them out. But here are your choices. She says we could operate and take them out. And then she did say, you'd have to flush after that. And it's, impossible they could grow back. We could put you on a course of antibiotics for 3 weeks, or we could put you on antibiotics plus Flonase, and I'll need a CAT scan. So the first thing I say is shouldn't we do the most conservative thing first? And she says, quote unquote, with the exact intonation, well, you could, right, only an idiot would.
Oh
right?
my God. Right.
And mind you, this was somebody who was salaried, so it wasn't like she's making any more money to operate on me or anything. Yep. So then I make this mental note to get out of there. And then I say, well, 3 weeks seems like a long course of antibiotics. And also, I don't think it's bacterial. And she said, well, my patients get good results for the antibiotics. I'm thinking I really got to get out of there. So I agree to the Flonase for my hoarseness, right? I agree to the Flonase for my hoarseness. Then, then I leave. And I maybe live, 10-minute bike ride from the doctor's office. But when I get home, there's already a voicemail. This was in voicemail days, not email, from the imaging center scheduling a CT scan of my sinuses, right? So I just think, well, I'll ignore it. It'll go away. No, they call like 2 times more. So I think I got to call back and not get this, or they're going to charge me. So I didn't get it. And I'm just doing the Flonase for my hoarseness. And then at some point I read the little label, the FDA insert inside the Flonase, and it says, side effects may include hoarseness. Okay, so then, I stopped taking the Flonase. And then like a month later, I get this nasty, or maybe 2 months later, this nasty note from the PBM says, you're not renewing your Flonase. So then I have the epiphany, which is if this kind of overdiagnosis and overtreatment could happen to me, it could happen to anybody.
Sure.
And that's where I got the idea to do Quizify. Now, why do it in form of question and answer, trivia? Well, I myself am a trivia buff. I was on Jeopardy once. I wrote a best-selling trivia game. Newsweek presents the ultimate trivia game, I don't know, back in the 80s at some point. So I knew how to write trivia questions. So I thought, if I put the trivia together with the healthcare, that's a business model. And that's how Quizify came to be.
Wow. So did you win on Jeopardy?
Well, let me repeat, and I'm not sure you caught it, but I was on Jeopardy once. Okay, yeah.
I did catch that out.
Okay. All right. So in any event, so that's how it started, and we still do classic Quizify, still by far our bestseller. We do every topic known to mankind in healthcare that's relevant to individuals.
So I'm sorry, not to drag you back to the PTSD, but who the hell beats the Quizmeister at a trivia game? I don't get it.
Okay, I'm glad you asked. So the answer is that this fellow named Bob Verini. Now, Bob not only beat me, he became, in those days, you could only be on 5 times. He became a 5-time undefeated champion. He won the 1987 Tournament of Champions. He won the Decade Tournament of Champions. And as total coincidence would have it, he moved across the country. Now lives about a mile away from me, and we get together sometimes.
Oh, wow.
Yeah, so I lost to a guy that's beat everybody.
A giant slayer, if you will.
Well, he did a good job. I mean,
did you keep it close, or did you get smoked?
No. It was close to the end. The third person on the far left had no idea what hit her. She got like 2 questions the whole time.
You weren't the guy that couldn't figure out the math at the end of the game, though.
I was the guy who couldn't figure out the math at the end of the game. So no. Here's what happened.
Yeah.
So he had, I don't remember the exact number. He had like $9,000 and I had $7,000.
Yeah.
Let's just say, for the sake of argument, I had $6,000. Okay. He has 9. What do you wager in Final Jeopardy in that case?
He's got 9, and you have
9. You've got 6.
You've got 6. Well, it depends on the category and how confident you are.
No, it doesn't actually.
No, so we're going to make this a pure math problem.
Yeah. So what's the answer?
$5.
0. Because he's figuring you're going to wager it all, so he's going to wager it all plus $1. So there's 4 possible outcomes, which is we both get it right, in which case he wins regardless.
Yep.
I get it right and he gets it wrong, in which case I win. he gets it right and I gets it wrong. Obviously, he gets it. But then there's one other category, which is both get it wrong, which is actually what happened. And so he's losing $3,001. So he goes to 5,999, and I'm still at 6,000. So of the four possible outcomes, wagering zero puts one of those outcomes from lose to win.
Oh, that's so cool.
Yeah, I figured it out like a month later,
Right. So you bet more than zero, obviously.
I bet more than I should have. I should have just bet zero. Yeah.
I just saw something interesting on Let's Make a Deal. They have a math problem for. Have you ever heard of this before?
Oh yes.
So you can explain it better than I can. What do you do on Let's Make a Deal?
Well,
first explain what Let's Make a Deal is, because if the youngsters are tuning in,
right. So Let's Make a Deal is that Monty Hall was the guy's name. He just died within the last 3 or 4 years.
Oh, I didn't hear that.
Yeah, he. So you would go down and he would like give you a prize for something other, and he'd ask you if you wanted to trade it for something else, and you didn't know what the other thing was. And at the end of the show, they had 3 doors: door number 1, door number 2, and door number 3. And they took the person with the most prize money. And they said, do you want to trade this all for what's behind one of these 3 doors? And they would give you 2 chances. So if let's say you guessed door number 1, and it turned out that door number 1 was, and then they would they'd put door number 3 up. They'd open door number 3. Okay.
Right.
They'd say it's not door number 3.
Yep.
Now, you think you'd have a 50-50 chance by sticking with door number 1. But it turns out, for reasons I really can't explain and baffled statisticians for years, you actually do much better changing to door number 2. I mean,
they give you the option of sticking with your original choice or switching. Between your choice and the other one that's left. So in your example, if you go with door number 2, then are you better staying with door number 2 or are you better with switching? And the answer is you're better doing what?
Switching. You're better
every time.
Every time. Well, statistically, if you did it 100 times, you'd win, I don't know, I think like 2/3 of the time or something like that. But it's a classic statistics problem that
Very
people
cool.
argued about for years. And finally, they just had to do it heuristically. They just had a heuristically, meaning they just did it a whole bunch of times to figure it out.
Right. Now, if you can get me on Let's Make a Deal, I will go on that show. Okay, Jeopardy, I'm pretty good at, but my guess is you would smoke me at Jeopardy, even though I am pretty good.
Yeah, and yet for all my trivia knowledge, I don't even know if Let's Make a Deal is still on the air. I think
probably not.
On the game show. I think it's on the game show channel or something.
Yeah. So where were we on our healthcare journey?
All right. So I have now figured out this Quizify. We have the Q&A. We're doing, all this, what we call classic Quizify. And then I get involved in some ER stuff with, I have to give credit where credit is due. Marty McCary was the guy who inspired this. Now, Marty McCary figured out that, in fact, when you go to the ER, you do not have to sign their consent.
And for those folks that are just tuning in that have nothing to do with the healthcare space, Al's referring to Marty McCary, MD, went to Harvard undergrad. I don't know where he went for medical. Maybe it was Harvard Medical School. Johns Hopkins trained, brilliant guy, wrote, in my opinion, one of the best books. If you really want to understand the dynamics of what's going on in healthcare and the business side of it, pick up a copy of his book, The Price We Pay. Al also authored a couple of books. What's the one that you authored with Tom Emmerich?
With the Walmart, the guy from Walmart, Tom Emmerich.
The VP of Walmart, yeah.
It was called Cracking Health Costs.
That was also an excellent book that I highly recommend. Honestly, you know, if you haven't figured it out, Al is not only a wealth of knowledge, but he's entertaining as well. So that's a double threat.
Even people who don't like me, which is to say essentially every wellness vendor, will admit that I'm entertaining.
There we go. Go ahead.
Yeah. So in any case, Marty, by the way, he did give me, and Quizify, a nice shout out in this book, the one you mentioned. But for those of you who are not in healthcare, if you've seen the show The Resident, I don't know if I think it's done now, but it ran for like 7 or 8 seasons. It was based on him. He was actually the original inspiration. That was him.
Oh, did not know that.
Yeah, I mean, he didn't play himself, but the character was based on him. So Marty had understood that the Emergency Medical Treatment and Active Labor Act of 1986 required you to be hospitals to treat you as an emergency, not an elective, as an emergency, even if you couldn't pay, even if you didn't agree to their financial terms, they still had to treat you. Now they didn't have
so
to.
if you go to the ER, MTALA, if you go to the ER and you're in active delivery, you're having a baby, or you're bleeding out, you have an emergency, federal law of the land says you must be treated. They can't turn you away.
Right. It doesn't even have to be a huge emergency like the ones you just mentioned. Essentially anything that even arguably qualifies as an emergency. Now, the reason they did that was years earlier, and I remember this as a consultant at Bain and Company, hospitals could just tell you to take a hike, or we were working for Memorial Hermann Hospital in Houston. And what we learned was that all the for-profit hospitals were sending all their emergencies over to us. You can't do that anymore, thanks to EMTALA. Well, so that was Marty's insight. Now, my insight from Harvard Law School was that yes, he was.
I'm sorry. Marty said you don't sign it. Don't sign the financial
argue
consent.
about it later.
Got it.
And my insight was, let's go one giant step further from that, and let's write in our own consent. Okay. And I specifically, now Medicare reimburses very little for ER visits. Commercial reimburses much, much greater. The reason it reimburses so much greater is because when the hospitals have the contract negotiations with the health plans, they say, well, we have to treat everybody who comes in the door for emergencies. So you gotta help us subsidize that. So they jack the prices way up for in-network. Don't even get me started on out-of-network. They jack them way up for in-network. Okay.
Right.
And the other thing is, whereas a health plan or a payer could steer electives, to like, if you want your joint replaced, you get a better deal if you go here. You can't steer emergencies. Someone goes to the nearest hospital.
Right. Sure.
So the consent says that you agree to pay 2 times the Medicare price. And the Medicare price is so low that 2 times Medicare ends up being about somewhere between 30 to 40, or I'm sorry, let's do it the other way around, 50 to 70% lower than the commercial price. I mean, just huge deal. It's like a record.
Then their negotiated price,
then
right?
The negotiated price.
Yeah.
Yes.
So folks, Medicare, right? If you're 65 or older and you have Medicare, then you're getting a very, very low price. Commercial payers are what, most Americans have. They're getting their coverage through their employer, and, they're commercial payers, right? So those insurance carriers pay the highest rates. And what Al is saying is, it's an exponentially higher rate than Medicare. And so if you're going in and you're just signing that consent, you're almost surely getting fleeced.
Oh, you're absolutely there's no question you're getting fleeced, except in 2 states.
Okay.
One, and this will give you a sense of how much the markup is elsewhere. Because if other states, you're looking at $3,000 and $4,000 for the average emergency visit. Maryland has what's known as an all-payer system. In that all-payer system, it does not matter who your payer is. Your average ER bill is going to be about $800 to $900 as opposed to national. Now, remember how I said how the reason that the hospitals can charge so much is they argue that we got to cover all the uninsured people, right?
Yeah.
Well, Massachusetts has essentially universal health care, ironically due to that very same Mitt Romney that I mentioned earlier. And as a result of almost everybody being covered, the average ER bill in Massachusetts, which is a high-cost state in general and a high-cost state for healthcare, is absurdly low. It's like $1,200, as opposed to like if you went to Florida, for example, you're paying $4,500 for a visit.
Wow.
So if you take the Medicare number, which is going to be $100, $200, $300, $400, $500, depending on the level of severity, which, by the way, the hospitals lie about that too, up, down, and sideways. You go in, I'll get to the line part in a second, but you go in and you write in the consent where you have to sign the financial consent separately from the treatment consent. Instead of signing it, you either write in our consent, which is a 29-word consent, the most important part of which is the 2 times Medicare, or if you're a qualified client, we have these little stickers that we give you, just put on it. And we also have it right on your phone. I could show it to you if I'm
Oh, that's the coolest thing. I have it downloaded as well. Why is the 200% or 2 times Medicare the most important part of it?
Because if you go in and you say, I want to pay 1 times Medicare, the hospital is well within their rights. They're well within their rights anyway. They can say, we don't accept your consent and argue about it later. And then if you were to argue about it, they would say, why should this schmuck get to pay the same price that our biggest account pays? Whereas if you go in for 2 times Medicare, they can't say that.
So that was your epiphany and altering or kind of piggybacking off of what Marty McCary put out there. You said, well, for this to hold up in a court of law, we have to include this.
Right. That was the Harvard Law School training coming in. Yeah.
Excellent, Al. Thank you for that.
So a couple of sidebar observations. One is people say, well, why don't other vendors do this? Well, frankly, if there's another vendor whose CEO went to Harvard Law School, they probably would do it if they thought about it.
Yeah, sure. Well, I mean, it's just a mind blower to me that we have a system in which, that one signature is probably responsible for a good percentage of the 100 million people that are under the pressure of medical debt in this country. And that's not, I didn't make that number up. There's over 100 million people with medical debt in the US. And you could bet there's a pretty good percentage of them that probably originated in the ER, which is why I commend you for coming up with this. I think it probably erases all of the dirty work that you did, unbeknownst to you.
Unbeknownst to me, yes.
When you were working for the evil empire at Bain, and we're not saying those folks are evil.
It wasn't the Bain people. The Bain, the Bain. If a CEO wants to hire Bain, that's on the CEO.
Right, of course.
It was the health plans, and
of course.
In all fairness to the health plans back then, my sense was they were very well intentioned. It's just like the wellness industry started out with the best of intentions, and the PBM industry started with the best of intentions, but after a while, your fiduciary responsibilities to your shareholders.
Right.
So after a while, when you figure out that what you're doing isn't adding any value, you still have to keep doing it.
Right. So just to wrap up on EMTALA and prevent consent, if you find yourself in the ER and they're going to give you 2 consents, right? One is authorization for them to treat you. You have to sign that one, right? And the other would be financial responsibility, in which case you don't sign that, you strike their language, you include the language that we have on our website, a link to Al's site at Quizify, and you could, download that. If you're a Quizify client, Al's team puts them on stickers for you. You could stick it right on your medical ID card. The important thing is you could have it on your iPhone. The important thing is that you write that language in kind of word for word just to cover your ass, right?
And if I could add 2 or 3 things to that, is one, if I don't know if this is true if you're not a Quizify client, but Quizify clients, it's geolocated.
Yeah.
So when you go to the ER, it pops up. And for Quizify clients, also, if the ER gives you a hard time, there's a 24/7 number to call. And there's also a number to call for billing disputes. And we bat 1,000 in billing disputes. And I will tell you the names of the hospitals that have completely caved. So Vanderbilt Hospital took 100% write-off. Because when we looked back at the thing, they would not give this person a financial consent. The person knew they were supposed to sign the financial consent. They didn't want to get in trouble with the feds for the Emergency Medical Treatment and Active Labor Act. So they caved. And the same thing happened with and these are big hospital systems, the Baptist hospital system in Florida. Same thing happened. We threatened them with an EMTALA complaint, which goes to the feds. I mean, they're probably very well tied in with the state. The feds are serious about EMTALA. This was a dispute that had been going on for months. And as soon as I mentioned EMTALA, they caved within 3 hours.
Wow.
I've got the letter, we're putting it up on the website. The patient doesn't mind the name being used. We took out account number, obviously.
What kind of money were we talking about? What were they responsible
$4,500. And they would have been responsible. And this is somebody, in the second case, not the first, this is not this is somebody who, like the 100 million people you mentioned, it would have put a huge dent in finances.
Of course.
And in this particular case, in the case of Baptist, they did not give you 2 signature lines. That was the EMTALA consent. And I don't know why I was the first person to notice, but it was in plain view. I mean, they used the same consent and they said this right at the top. They said, this is our consent. And they listed all their clinics, all their outpatient facilities, all their everything. I'm looking and say, you can't use the same consent for elective as for emergencies.
Right.
And the thing is, the other thing they did that was not that bright was, nor did Vanderbilt, is they didn't say, okay, we'll write it all off, but you can't use our name. So here they are, And if you're out there, University of North Carolina, we're coming for you next.
Oh boy.
Yeah.
Hey now.
Okay. I believe, I'm not going to say this, just like they say that Stormy Daniels allegedly had an affair with Trump. I'm going to say they allegedly violated EMTALA. I have not proven it. I believe that they have, but it's not been shown yet.
Yes, we get that. Amazing. It's one of the things that we oppose. We look at the movement to high deductible health plans and HSAs attached to them. And I think the big miss for employers is the percentage of the population that could really deal with the out-of-pocket expenses tied to those plans. And I would argue much the same is true of the emergency visit. If you're going in and you're not paying attention and you sign everything that they put in front of you, and it's kind of human nature, I think the only consent that probably is less read is the iPhone agreement. Every time you download that, I mean, who the hell reads that out?
On the other hand, it's not going to bankrupt you. But if the person involved with the plaintiff or the patient and the UNC one says, I could afford this, but I think no one should go through what I went through. Her situation was. And I'm 99% sure I could use her name, but there's no reason to. So her spouse works for a state or local government, and they don't, typically pay very well, but they have amazing benefits. So he had been to the ER once or twice, and his responsibility was like, I don't know, $400 or something. So she goes to the ER because it's a Sunday, and she doesn't want to wait till the next day, and because her heart's beating, fast. It's beating like 100 times a minute. So she goes in and, waits for a while, and the doctor examines her and says, well, how much coffee are you drinking? He says, well, you should drink less coffee. And so she doesn't get a diagnosis. Her heart was beating fast enough for a finding, which is not the same as a diagnosis, much lower than a diagnosis, of tachycardia, but no diagnosis, no prescriptions, and she walked right out and her heart calmed down. And they billed that as, in addition to ignoring the consent, which she wrote in twice, I might add, not once, but twice. In addition to ignoring the consent, which is the EMTALA violation, they charged for a level 5, which is life-threatening. Right. And then, we get them on the phone.
For those of you who don't know, when you go to the ER, they code it according to how severe you are when you came in, correct?
Allegedly.
Yes, allegedly. But clearly, if they code you as a level 5, is that the most severe?
That's the most severe.
That's the most severe, as opposed to walking in with a hangnail. Which is probably a level 1.
A little tachycardia, which is a level 1 or a level 2.
And so what that results, though, in is a higher bill to the plan, to the patient, to the employer, all because of a billing code violation.
Yeah, I mean, and the thing is, and I get the guy on the phone. So, and by the way, he has a fellow by the name of Robert Broughton, Broughton. We're coming for you too, buddy.
All right.
From the Attorney General of North Carolina is in this meeting. Now, mind you, there is no formal dispute. There is zero reason for this
What?
guy to be in this meeting, other than patient intimidation, which, as you can see, is really working well, right? So
You look scared, Al. You look very scared.
And we say, and he says, well, we don't, first we asked about the EMTALA thing. He says, well, we don't recognize other people's consents. That's an EMTALA violation. The whole point is to recognize other people's consents or lack thereof. So then we ask him about the billing thing, level 5 for level 1. And they use what I call the Sergeant Schultz defense. He says, well, I don't know anything about billing. And I'm like, surely we're not the billing people,
Right.
So we're going to go hard after them because I want to maintain the 100% success track record that we have for disputed bills. And this is the one, most of these things never reach me. They get resolved, always in our favor, I might add. But the ones that reach me are the ones where the hospital isn't, violating TAL or whatever they're doing.
Right.
But I get them every time. And I got to get this one because this will make it 100%.
Have you ever had to show up in court?
No. But I tell you, I would if I needed to.
Yeah.
Now, I'm not a practicing attorney, but most of these things would not get beyond small claims court anyway. So I could easily go.
Small, so $4,500 is small claims. I thought it was
in most states. In most states, Massachusetts is 7,000 is the limit or something. Yeah.
But you could have bill charges in an ER that easily go into the tens of thousands. No,
you could, but it's here's what's happened. So those of you who are not in the industry are not familiar with something called the No Surprises Act, which made it so that hospitals could generally not bill high five or over 5 figures for an ER visit out of network. And what they did to maintain their revenues was they merely jacked up the coding level on the in-network. So for instance, this person with a tachycardia who probably would have been coded at level 1 or level 2 3 or 4 years ago gets coded at level 5 because they have to maintain their revenues. And we've seen this statistically speaking. It used to be that about 20 to 30% of ERs were level 4 and level 5, which are the two highest codes. And now it's more like 70% are level 4 and level 5 for no reason. People haven't gotten
no reason other than money.
No reason other than money. Yeah. So the hospitals have figured out how to essentially get around the No Surprises Act limitations just by jacking it. It's squeezing the balloon. No Surprises squeezed the out-of-network out of the balloon, so now the in-network goes up.
Wow. And so you mentioned some perks for folks that are Quizify clients. Just out of curiosity, and this isn't a commercial, what is Quizify and what would it cost an employer if they were interested?
If classic Quizify, and we've talked about the ER consent, which is part of Quizify, and that's where there's a big cash on cash, essentially immediate return. The classic Quizify is imagine sort of Jeopardy meets health education meets Comedy Central, right? So we turn, you don't have to answer a formal question, but we turn everything you need to know about healthcare into employee and engaging trivia games that generally are questions carry the Harvard Medical School shield, as they call it, because our stuff's reviewed. Our stuff's reviewed by doctors at Harvard Medical School. So it's all, they won't generally review products with brand names. And we do a lot of that stuff. Like, I don't know if you're familiar with that naked juice, you get in the store, the naked juice.
Yep.
Well, it turns out it says no sugar added on. Turns out it's full of added sugar. So that's the kind of product that we go after. Harvard Medical School folks won't let us put their name on it for obvious reasons.
Right. Interesting. So it makes it fun. And what is the engagement like? I mean, you were, you're the harshest critic out there of quote unquote wellness programs. How effective is Quizify?
Well, first of all, we cost about 1/10 as much. We probably get about 10 times as much engagement if you give the same incentive. Yeah. In fact, our engagement is so easy to get that we say, you don't have to give people $500 to play 12 quizzes. You have to give them $500 to show up at a stupid screening, which is worthless. just have a few drawings or give people, I don't know, $100 if they do a quiz or something like that. And we do that. We get probably 5 times the number of plays that a wellness company would get for 1/5 of the price.
Yep.
You asked what the specific price was. It starts at $12 per employee per year. And as your organization gets bigger, it goes down from there.
So it's $1 a month per employee. Per month.
If you're a smaller group, yeah.
Yeah, that's amazing. And you're also affiliated with an organization called Validation Institute.
Yes, I was actually the founder of the Validation Institute. It's based on
tell us about that a little bit.
Well, the Validation Institute is based on my book, Why Nobody Believes the Numbers. And there was a guy, a friend of mine, who I've known for a long time, by the name of Sean Slavinsky. He's still out, he's still doing great for himself. And he ran a joint venture of General Electric and Intel called Care Innovations. And they felt like they were losing business because due to their corporate ownership, they had to be honest about their outcomes. And he said, Al, these other companies are all, making up their outcomes in our space. And their space was post-acute care management or something. And so he said, well, maybe we should start like some kind of institute that sort of measures the validity of things. So I said, yeah, we'll call it the Validation Institute. And he had a big budget left over because when he got there, this joint venture was very fat and he cut a bunch of people. So he had a budget to spend. So he was able to fund the thing. And, it did well for a while. And the integrity was such that even though they were funding it, Care Innovations never actually was able to get validated for its own product. I have my standards. Right? Ironically, one of their competitors did get validated.
Oh, wow.
But, we had to play it straight.
That was one of my questions. I was wondering, have you had submissions where the numbers just don't math?
Oh, most of them. I mean, I can name names. I will name names. I mean, you take Livongo. In fact, I'll tell you what. I did name these names: Livongo, Omada, and I said, there's a couple of diabetes companies, Virta and Diathrive, where the numbers do add up and they're validated. But then there are a whole bunch that
I was going to mention Diathrive because we have that solution in one of our clients.
We do,
and it works. It works. It lowered their cost. And what Al's referring to is, so with the Validation Institute, I always say in insurance and particularly with brokers, what's the next new shiny object? They're always chasing shiny objects. The typical MO is to drive revenue. So something new comes out, they put it in front of their client. This is wonderful. This is the next best thing since sliced bread. Shout out to my former employer, Sam Goldstein at B&H. He said, Ray, nothing is as good as sliced bread. It's just so perfect. Nothing. So these things, for the most part, are bullshit, right? And so,
to use a technical clinical term, yes.
Or as my father-in-law, who emigrated here from Sicily, would say, bullshita. So you learned Sicilian today. So they actually a company pays a fee to submit their quote unquote shiny object. And the Validation Institute puts that product through its paces or service through its paces. Are there services or just products?
Yes and yes.
Both, yeah. And they do the math and they grade the efficacy on a scale of, I think, 4 levels, right? 1 to 4. Or is it 5?
They're different. There's 5 different levels of validation. The first thing you should know is that of the people who come in, probably 10% get validated for essentially exactly what they wanted to be validated for, like Diathrive did, or Virta for that matter. Yep. Probably 70% do get a validation, but we scale it back so that they're not getting what they want, but they're getting something, and it's important for the Validation Institute because Validation Institute has what's known as the credibility guarantee, where if in fact it turns out we didn't get our numbers right, someone can go to arbitration and get like $50,000 from the Validation Institute. And then about 20% are just told, this doesn't work. I mean, this is all based on statistical fallacies. Come back another time. So now
have you had to pay out the $50,000?
Oh goodness, no! Any more than I have to pay out the $3 million bet for wealth. You don't want to go up against me. You might as well. You don't want to tug on Superman's cape. You don't want to spit in the wind. It's right up there for those.
And
things.
that, ladies and gentlemen, is what we call a competitor.
And any more in the words of the great philosopher Clint Eastwood, make my day. I would love it if somebody tried to challenge on this. So there are different levels. You can be validated for, say, a contractual guarantee. Like a lot of people guarantee that they save money. And by the way, Ray, to your earlier point, one reason that employers don't believe you is it's very possible to say you save money, you guarantee it, but not. So, for instance, WellSteps, which is a wellness vendor, they guarantee their savings, but they're making up the way they measure the savings. So the guarantee is worthless, right?
Right.
So we call that a contractual integrity guarantee. And then there's an outcomes guarantee where you're not promising savings, but you're saying that you will move the needle on a particular outcome. Maybe you'll improve engagement. Maybe you'll reduce the number of people who, I don't know, go to the ER for one reason. Whatever it is, you're not promising that it saves money. So, there is one wellness vendor, which is an excellent one of probably the only good wellness vendor called U.S. Preventive Medicine. They have an outcomes validation, and they'll be the first to tell you that, you don't necessarily save money, but you will move the needle. And so that's what they're validated for.
Move the needle how? In terms of
reduce the number of people at high risk, not just by reducing the number of people at high risk, because anybody can do that, because people's risks change. Like let's say you're a smoker. Let's say that everybody in an organization smokes and quits for a year at a time. Okay.
Yeah.
And let's say you're a wellness vendor and you're promising to get smokers to quit. So you start, and that's the only risk factor. So you start out with the 50% who are smoking. You say, see, we got them all to quit next year. And then the following year, the other 50% is smoking. You say, see, we got them all to quit. Ad infinitum. So as a wellness vendor, you're reporting 100% savings every year, when in fact, 100% reduction in smokers every year, when in fact, the percent of smokers is remaining the same. So what U.S. Preventive Medicine did, which is why they got validated, is they didn't just look at, to continue the analogy, if it was just smoking, they wouldn't have looked just at the number who went from smoking to quitting. They would net that out against the number moving from quitting to smoking, which is valid. So they did this validly. So then there's a savings validation, which is what Quizify has, thanks to the ER consent and thanks to our weight loss drug. We figured out how to prevent people from just using weight loss drugs at employer expense for cosmetic reasons or casually, which is we give them this 24-question quiz in advance that covers all the things that the influencers don't tell you about, all the side effects, all the downsides. We call it the Curve Their Enthusiasm quiz. And we guarantee that, I think right now we're guaranteeing that only like 20% of people who finish that quiz or start the quiz will end up on the drugs.
Oh, that's interesting.
So
on a future episode, we're going to have Charlie DiMaggio and he was an ER physician's assistant for many, many years at Elmhurst in Queens, New York City, one of the busiest ERs around. He's a professor at Columbia. He worked at the CDC. And one of the things that we're going to tap into is this weight loss drug craze, Livongo and Ozempic and all that stuff. So
Livongo's a diabetes.
Sorry. I misspoke.
I think you mean
not an MD.
Not an MD, but I think one that ends in O would be Mounjaro. So that's probably one you're thinking.
Mounjaro. There we go.
Yeah. Which is now called Zepbound for weight loss for reasons that aren't worth going into. But in any event, so Quizify has that level of guarantee, the savings guarantee, because we could cash on cash. We're getting you savings basically the next day, just by teaching people everyday stuff that they didn't know that they can apply like that. And then the highest level, which is the level that Virta and Diathrive have and a couple others. Diathrive has what Quizify has, the savings validation. If you do actual RCTs to institutional reward standards, actually IRB standards, not comparing participants and non-participants, which is completely bogus, and everybody knows it except for the people who somehow buy these products. You're like in the case of Virta, they had two sets of folks, both Indiana University, both the same benefits design. One was one campus, one was the other campus. And they offered Vert at one campus and not the other campus. And they had the specs for getting into the program were the same. You didn't know when you got into the program whether you're going to get the drug or not. I mean, classic RCT, and Vert won. Now, not a lot of people do the Vert program, but that because it's hard.
RCT, randomized controlled trials.
Randomized controlled trial. So they killed it on that. They killed it on, they had I'm not allowed to say where the other one was, but they had what's known as a waitlist control, where you sign up for a program, say 400 people sign up for a program and they only have 200 slots. So what you've done at that point is you have controlled for motivation, right? Because all 400 wanted the program, but you only gave it to 200. So then you compared that 200 to the other 200. So they did that as well. I mean, the classic, and this is worth a little sidebar, the classic waitlist control, which actually is the same as a lottery control, was an Oregon Medicaid, where they had a certain number of slots, and there were too many people, and they all signed up, and they picked X number, and then they compared how well they did to the others. And the person who did this is, one of my heroes, and probably the best researcher in the industry, named Catherine Baker at University of Chicago. And to her credit, when I was right and she was wrong about wellness, she, basically did another study and found, in fact, I was right. This Oregon study was one for the ages. She examined both groups and found, interestingly, that the people who are on Medicaid versus the people who qualified but did not get Medicaid had essentially the same physical results, no matter how you measured, but their anxiety levels and their depression was much lower. For exactly the reasons we talked about earlier, that in fact they didn't have to worry about high medical bill the next day, kind of thing.
Interesting. Wow. So, and I bring up Validation Institute because I think it's a tremendous resource for anyone that might be an employer, or if you're in that channel of an executive that's managing healthcare, and your broker, brings in the next shiny new object. Might be worth a visit to go over to Validation Institute, take a look, see if that company is there, if they're listed. Is that public facing, by the way? Can anyone see
is public facing. Okay. Here's the interesting, you don't even have to do that. You just have to ask them if they're validated by the Validation Institute. And what they will probably say, well, sometimes they are. What they'll probably say if they're not is, oh yeah, we're looking into it. Or sure, if we get the contract, we'll get validated. Something like that. No, you got to be validated. So it's the gold standard. I mean, the thing about actuaries, if you pay them enough, they'll tell you save money. And I think people figure that out by now.
Right, for sure. Well, hey, Al, it's always educational and it's always entertaining. And we really appreciate you taking the time out of your day to be here and visit with our audience. And we hope to see you again.
I'll look forward to it. We can talk weight loss drugs. Those are a lot of fun. Awesome. And just again, I want to make sure people know how to find you. If people want to find Al Lewis, what's the best way to do that? It's al@quizify.com. All you got to remember is al and quizify.com, and you got me.
2 Z's in Quizify?
2 Z's in Quizify. Yes, we were going to get the 1 Z as well, but someone wanted $1,000 for it. Tell them to go to hell. People just have to remember the 2 Z's.
2 Z's in Quizify. Yeah. Excellent. Well, hey, thank you again, folks. Another great episode. Appreciate you tuning in. We'll see you on the next one.
So that's it for today's episode of Broken Healthcare. Head on over to iTunes or wherever you listen and subscribe to the show. One lucky listener every single week who posts a review on iTunes will win a chance in the grand prize drawing to win a $15,000 value private VIP day with Ray Kober himself. Be sure to head on over to brokenhealthcarepodcast.com and pick up a free copy of Ray's gift and join us on the next episode.